The main purpose of pre-cleaning at the point of use is to A. Preserve surgical count sheets. B. Prevent drying of bioburden. C. Shorten sterilization cycles. D. Reduce water spots on instruments. Answer B. Pre-cleaning removes gross soil and prevents blood and tissue from drying, which would make decontamination less effective. What is the ideal pH range for most enzymatic detergents used in instrument cleaning? A. 2 to 4. B. Neutral only. C. 9 to 11. D. 5 to 8. Answer D. Enzymatic cleaners are typically near neutral or slightly alkaline to protect instruments while enhancing enzyme activity. Which part of a hinged instrument must remain open during sterilization? A. Ratchet. B. Box lock. C. Finger rings. D. Tips. Answer B. Opening the box lock exposes internal surfaces to steam or gas, ensuring all microbial life is destroyed. When testing a mechanical washer, a test soil must A. Simulate human tissue and protein. B. Contain sodium hypochlorite. C. Be visually clear. D. Replace detergent entirely. Answer A. AMI standards require test soils that mimic organic matter to confirm cleaning efficacy of mechanical washers. Which sterilization method is most affected by organic residue left on instruments? A. Steam. B. Hydrogen peroxide plasma. C. Ethylene oxide. D. Ozone. Answer B. Hydrogen peroxide plasma can be neutralized by organic matter, preventing sterilant contact with surfaces. Bowie-Dick testing verifies A. Temperature accuracy of sterilizer chamber. B. Air removal and steam penetration in pre-vacuum sterilizers. C. Pressure gauge calibration. D. Biological spore destruction. Answer B. The Bowie-Dick test ensures air is completely removed and steam can penetrate porous loads effectively. What is the most accurate indicator of sterilization effectiveness? A. Mechanical printout. B. Chemical indicator. C. Biological indicator. D. Cycle timer. Answer C. Biological indicators measure the actual destruction of highly resistant bacterial spores, confirming sterilization efficacy. The lumen of a flexible endoscope must be dried using A. Filtered compressed air. B. Alcohol flush only. C. Ambient air exposure. D. Gauze swabs. Answer A. Filtered compressed air ensures complete drying of internal channels without contamination. What is the purpose of a process challenge device, PCD? A. To evaluate sterilant penetration. B. To check temperature probe accuracy. C. To confirm detergent concentration. D. To test water quality. Answer A. A PCD simulates the hardest to sterilize load, confirming sterilant reaches challenging areas. The recommended exposure time for steam sterilization at 270 degrees Fahrenheit 132 degrees Celsius for wrapped items is A. 3 minutes. B. 4 minutes. C. 10 minutes. D. 30 minutes. Answer B. Standard pre-vacuum cycles require 4 minutes at 270 degrees Fahrenheit to ensure complete sterilization of wrapped instruments. If an instrument set is wet after steam sterilization, the next step should be A. Move to storage immediately. B. Reprocess the entire load. C. Dry with a clean towel. D. Vent chamber for 5 more minutes only. Answer B. Moisture compromises package sterility and requires complete reprocessing. Which material is compatible with hydrogen peroxide sterilization? A. Paper wraps. B. Cotton gauze. C. Polypropylene trays. D. Cellulose-based wicking. Answer: C. Polypropylene is compatible because it allows sterilant penetration without absorbing the hydrogen peroxide. Decontamination area air pressure must be A. Negative to surrounding areas. B. Positive to prep area. C. Neutral to all zones. D. Positive to clean side. Answer: A. Negative pressure prevents airborne contaminants from spreading to clean areas. Which step occurs first in instrument reprocessing? A. Inspection. B. Decontamination. C. Sterilization. D. Packaging. Answer: B. Instruments must be decontaminated before any further handling to ensure safety. The primary chemical used in high-level disinfection of flexible endoscopes is A. Phenolic solution. B. Glutaraldehyde or orthophthalaldehyde, OPA. C. Quaternary ammonium. D. Iodophor. Answer: B. Glutaraldehyde and OPA provide effective high-level disinfection without damaging delicate scopes. What must be verified before releasing a load from a sterilizer? A. Operator initials only. B. Label color change. C. Temperature chart alone. D. Mechanical, chemical, and biological indicators. Answer: D. All three parameters confirm time, temperature, and microbial kill conditions were achieved. How often should biological indicator testing be performed for steam sterilizers? A. Every load. B. Daily, or each load with implants. C. Weekly only. D. Monthly. Answer: B. Daily BI testing ensures ongoing sterilizer reliability. Each implant load requires a BI. A rigid container with a missing filter should be A. Double wrapped. B. Used with caution. C. Rejected and reprocessed. D. Taped shut. Answer: C. Missing filters compromise barrier integrity, making the container non-sterile. What is the minimum exposure time for ethylene oxide sterilization? A. 20 minutes. B. 30 minutes. C. 1 hour. D. Depends on humidity and load. Answer: D. EO cycles vary based on load density, humidity, and gas concentration. Parameters are load-specific. The acceptable TDS, total dissolved solids, for final rinse water in sterile processing is A. Less than 10 ppm. B. Less than 50 ppm. C. Less than 100 ppm. D. Less than 150 ppm. Answer: A. Final rinse water must have very low dissolved solids, less than 10 ppm, to prevent spotting, corrosion, and residue on sterilized instruments. Which inspection tool is best for checking scissor sharpness? A. Nylon string test. B. Visual inspection only. C. Magnification. D. Paper or latex test strip. Answer: D. Cutting a thin test strip confirms sharpness and alignment of blades. What is the most critical parameter in steam sterilization? A. Steam quality. B. Temperature. C. Time. D. Pressure. Answer: A. Steam must be saturated and free from non-condensable gases to transmit heat effectively. When labeling peel packs, ink should be applied. A. Over the seal. B. On indicator strip. C. On plastic side. D. On paper side. Answer, D. Writing on the paper side prevents punctures and maintains integrity of the plastic barrier. What instrument damage indicates use of saline during surgery? A. Rust. B. Bluish staining. C. Pitting corrosion. D. Surface etching only. Answer, C. Saline corrodes stainless steel, creating deep pits that trap microorganisms. Which step prevents bioburden buildup inside power equipment lumens? A. Wiping with alcohol. B. Flushing immediately after use. C. Ultrasonic cleaning only. D. Dry heat exposure. Answer, B. Flushing lumens at the point of use removes blood and debris before drying occurs. A failed biological indicator means A. Load can be quarantined until repeat test passes. B. Instruments may be used if chemical indicators changed. C. Only rerun BI test next day. D. Load is automatically sterile. Answer, A. Loads with failed BI results are quarantined and not released until retesting confirms sterility. What is the main difference between sterilization and disinfection? A. Type of water used. B. Temperature range. C. Sterilization destroys spores, disinfection does not. D. Sterilization is faster. Answer, C. Disinfection kills most microbes but not bacterial spores, while sterilization eliminates all life forms. Instrument tracking systems enhance. A. Payroll accuracy. B. Inventory control and accountability. C. Air exchange rates. D. Manual counting speed. Answer, B. Tracking systems record instrument movement, usage, and location, reducing loss and increasing traceability. The key reason for inspecting insulation on laparoscopic instruments is to prevent A. Mechanical damage. B. Thermal injury to patient tissue. C. Sterilization delay. D. Calibration failure. Answer, B. Damaged insulation can cause electrical burns during electrosurgery. What indicator verifies correct assembly of a wrapped tray? A. Class 1 tape. B. Class 5 integrator. C. Class 6 emulating indicator. D. Class 4 multivariable. Answer, D. A Class 4 multivariable indicator reacts to time, temperature, and steam, confirming that a wrapped tray was properly assembled and exposed during sterilization. The ultrasonic cleaner removes soil primarily through A. Enzyme activity. B. Cavitation. C. High temperature. D. Magnetic vibration. Answer, B. Cavitation produces microscopic bubbles that implode, dislodging debris from surfaces. Instruments with multiple parts should be A. Fully assembled for sterilization. B. Disassembled according to manufacturer's IFU. C. Sterilized open but locked. D. Processed in mesh bags. Answer, B. Manufacturer's IFU ensures correct disassembly for thorough cleaning and sterilization. The cooling phase after sterilization prevents A. Wet packs. B. Microbial growth. C. Air entrapment. D. Thermal shock. Answer, D. Gradual cooling avoids condensation and protects packaging from damage. Load control numbers should identify A. Patient name and surgeon. B. Sterilizer, cycle, date, and load. C. Instrument manufacturer. D. Operator shift only. Answer B. Each sterilization cycle must be traceable by load control for quality assurance and recalls. How long should wrapped instruments be dried after steam sterilization? A. Until visible moisture evaporates. B. No drying is needed. C. 10 minutes maximum. D. Full cycle completion per manufacturer. Answer D. Manufacturer-defined drying times ensure sterile integrity and prevent wicking. The presence of blue or rainbow discoloration on an instrument indicates A. Water minerals. B. Overheating. C. Organic residue. D. Improper detergent. Answer B. High heat causes chromium oxide discoloration, signaling excessive exposure or faulty sterilizer calibration. The maximum load weight for sterilization baskets should A. Never exceed manufacturer limits. B. Be estimated visually. C. Be doubled for large loads. D. Depend on packaging material. Answer A. Overloaded baskets prevent steam penetration and uneven drying. Chemical integrators placed inside sets confirm A. External wrap exposure. B. Internal exposure to all cycle parameters. C. Tray weight. D. Packaging seal integrity. Answer B. Internal indicators verify sterilant reach the most difficult area within a pack. If condensation forms in the sterilizer vacuum line, it can cause A. Incomplete air removal. B. Temperature increase. C. Faster cycles. D. Improved steam contact. Answer A. Condensation reduces vacuum efficiency, leading to residual air pockets that inhibit steam contact. Which water type is preferred for steam generation in sterilizers? A. Tap water. B. Deionized or distilled water. C. Softened well water. D. Filtered municipal water. Answer B. Deionized or distilled water prevents scaling, corrosion, and mineral deposits in the sterilizer. Sterile storage temperature should not exceed A. 60 degrees Fahrenheit. B. 70 degrees Fahrenheit. C. 75 degrees Fahrenheit. D. 80 degrees Fahrenheit. Answer C. Storage conditions between 68 to 75 degrees Fahrenheit with low humidity preserve package integrity. Sterilization documentation must be kept for at least A. 30 days. B. 6 months. C. 1 year. D. According to facility policy and regulations. Answer D. Retention varies, but AAMI recommends adherence to facility and legal requirements. What causes a wet pack after steam sterilization? A. Overloading or inadequate drying. B. Excessive steam pressure. C. Short exposure time. D. Long cool down. Answer A. Overloading and insufficient drying prevent moisture removal, resulting in wet packs. Which testing method measures the efficiency of cleaning equipment? A. Residual protein test. B. Bowie-Dick test. C. Chemical indicator. D. Air removal test. Answer A. Protein tests detect organic residues invisible to the eye, confirming cleaning effectiveness. Before sterilization, lumened instruments must be flushed with A. Alcohol. B. Distilled water. C. Air. D. Detergent solution. Answer D. Flushing with detergent solution removes blood and tissue from lumens, ensuring effective sterilization. The correct action for instruments dropped on the decontam floor is: A. Repackage and sterilize. B. Wipe with disinfectant. C. Clean and fully reprocess. D. Quarantine temporarily. Answer: C. Any item contacting the floor is considered contaminated and must be reprocessed. The final rinse in a mechanical washer should use: A. Hot tap water. B. Deionized or purified water. C. Cold water. D. Detergent water. Answer: B. Purified water prevents spotting and ensures residue-free instruments. The sterilization cycle record must include: A. Operator signature, date, and results. B. Packaging type only. C. Number of trays processed. D. Room temperature. Answer: A. Complete documentation provides accountability and traceability for each cycle. What is the first action if a sterilizer alarm indicates cycle failure? A. Restart immediately. B. Tag load as pending and investigate. C. Ignore if temperature was normal. D. Quarantine all loads for a week. Answer: B. Loads from a failed cycle must be held pending investigation and verification testing. Which of the following represents the most critical concept of sterile processing? A. Speed and productivity. B. Workflow from dirty to clean. C. Staff rotation schedules. D. Minimal documentation. Answer: B. Unidirectional workflow from dirty to clean prevents cross-contamination and ensures aseptic integrity throughout the department.